everyone, I'm Dr. Shazma Mathani.
And I'm Dr. Sheila Wijaya-Singha.
And today we're talking about HPV, or Human Papillomavirus. It's one of those things almost everyone has heard of, but very few people actually understand. So we're going to break it down clearly so you can protect yourself and your loved ones. But first, a word from our sponsor.
So we want to take a moment to thank Figs, our season sponsor. And honestly, this is an easy one for on Shaz, right? Because Figs are actually what we wear to work. Their scrubs are comfortable, flattering, and genuinely cute. We get compliments on them all the time from patients and colleagues, and they're incredibly practical. The pockets actually fit what you need: phones, notes, pens, everything. And in colder clinics and hospital hallways, the layers really do help keep you warm. Their compression socks are another staple of mine. Supportive enough for long shifts, but still cute. Same with their hair accessories, the headbands, claw clips, and scrunchies that actually stay in place on busy days.
And their work bags are so thoughtfully designed with multiple compartments to hold everything from my stethoscope to gear, power-up snacks, and a change of clothes. And if you don't work in healthcare, the Figs Lounger set is incredible. It's thick, soft, and high quality. I actually got my husband a set and he lives in it all the time. If you work in healthcare or you're shopping for someone who does, Figs just makes sense. If you go to wearfigs.com and use code FIGSDocTalk, that's FIGSDOCTALK, you'll get 20% off your first order. That's wearfigs.com, code FIGSDocTalk.
Okay, Sash, so let's get into this. I think HPV is something that I talk about almost daily in my practice and family medicine. It's so common, with about 75 to 80% of sexually active people at some point, they will be exposed at some point in their lives. And so while it can feel really scary to hear the word HPV, or if you've had a diagnosis, the important thing to remember is that most infections will clear on their own. And there's actually a lot we can do to prevent the complications that people do worry about.
And so we did actually have a thoughtful listener question that made us want to do this episode. So let's take a listen.
Hey docs, thanks for your podcast. This is Sarah. I just got a call back saying my HPV test is positive and I'm panicking. Does this mean I'm going to get cancer? They told me not to worry about it, but I am. Any advice?
Okay, first off, thank you for writing in. That reaction is completely understandable that you're having. When you hear the word positive in medicine, your brain jumps straight to the worst case scenario, and that's really understandable. But HPV positive does not mean cancer. Screening exists to catch changes early, long before they ever become something serious. It can actually take years from a positive diagnosis to actually have something convert into cancer. And the fact that you're actually getting screened is the first positive step that you've taken. So in most cases, we know that the next step is monitoring, not treatment, and not a cancer diagnosis.
And HPV is really common. Most of us don't actually know we've been exposed. And most infections, like you said, Sheila, clear within a year or two. Only certain high-risk strains can persist over many years, and those ones are the ones that can increase the risk of cancer. But this process doesn't happen overnight. In Canada, where you and I are, HPV is responsible for almost all cervical cancers. And according to the Canadian Cancer Society, about 1,550 people are diagnosed with cervical cancer every year, and about 400 die every year as well. HPV also contributes to a few other cancers, so anal, penile, vulvar, vaginal, and some head, neck, or throat cancers as well. So this isn't small, and it's not just a women-specific issue. And I think, previously when we think about like HPV and the vaccine, it seemed to be really focused on women because of the cervical cancer risk. But now we have learned over time that HPV actually can increase the risk of all those other cancers that I mentioned that are not just specific to women.
And I've had patients have those types of cancers, and often the question is, I thought this was just a woman's issue. And so this is a really important piece that you mentioned because it can affect all of us in different ways. We often think about HPV not being such a big deal. Relatively speaking, however, in Canada, it may not be the number one cancer diagnosis. However, globally, we know that it has a huge burden of effect. So the World Health Organization estimates that there's over 600,000 new cervical cancer cases each year and more than 340,000 deaths each year around the world. And because most of these cases are linked to HPV, the WHO has launched a global elimination strategy focused on vaccination and screening.
Yeah, and that one's so important. In Canada, screening programs significantly have reduced overall cervical cancer rates over the last several decades. But most recent data actually show that that decline has plateaued. And in some younger groups, rates are stabilizing or even slightly increasing. So there is still a real issue here when it comes to cervical cancer.
I remember early in practice, just like the rates are actually declining. And so it's really sad for me to see the rates increasing. And we're going to get into why that might be in a little bit too. So let's get into a little bit about what HPV is. So HPV is not just one virus. It's a group of over 100 related viruses, and it spreads through intimate skin-to-skin contact. Most infections do not cause any symptoms, and most will get cleared out of your own system. Your immune system will recognize it and clear it within a couple of years, like you said earlier, Shaz. Where we pay attention is when certain high-risk strains exist, and those may persist. So your immune system may not be able to clear those on their own, and those are the ones that can increase cancer risk as well. But that progression from infection to cancer can take many, many years, which is why timing is important in terms of our screening and screening regularly.
And I do want to clear up one myth in particular, and that's that HPV can lie dormant. So a positive result does not tell you that when you were exposed. It doesn't even imply recent exposure. It just says that you have been exposed to HPV at some point in time. In Emerge, I can see how quickly people can spiral with different results. And I mean, one of the things that's great now with electronic medical records is that people do have access to their results like quite quickly, which is great because I think it is really important to be able to have patients be a part of that and have the results. But the slightly negative side to that is that when people see the results without context, they can absolutely spiral. And I do have patients coming in, whether it's with this result or other results, that come in very, very concerned and anxious. But the thing to remember here is that infection does not equal cancer. There is a long pathway, like you've mentioned, Sheila, between the two, and that's where the prevention lives.
Yeah, Shaz, I think what's really interesting, like you said, there's different infections that people will get, and automatically, understandably, you want to know exactly the timeline that you were infected. That's the first question that comes up often after the cancer question is, who gave this to me? What was the timeline? Because I want to deal with this in whatever way. And I always counsel my patients and I say, listen, there's such a long lag period sometimes before symptoms can actually appear of HPV that we can't actually identify specifically when it was that the infection took place or transmission took place. And so it's not really a useful question, but it's a very understandable concern. But we can't unfortunately tell people exactly when the infection happened because it can be many years before it actually shows up.
Yeah, I mean, Sheila, that's a really good point. And I think that really leads us well into our next part, which is what HPV actually causes. And like you kind of mentioned, when people think HPV, they immediately think cervical cancer. And absolutely, that's appropriate. Almost all cervical cancers are linked to persistent HPV infection. But the thing that screening doesn't detect when we talk about HPV screening in particular, it doesn't detect cancer per se. It detects precancerous cell changes called cervical dysplasia. So that's what happens when you get your Pap test, for example. And then these changes can be monitored and treated before that cancer develops. So when we think about cancer, there are these precancerous changes that can occur, as those cells are transitioning into cancerous cells. And that's what we're looking for in the screening, because that is early enough that we can address that before those cells progress to cancerous cells. And that's why cervical cancer in particular is one of the most preventable cancers we have with that appropriate screening.
Like we briefly mentioned earlier, Shaz, as well, HPV also can contribute to different types of cancers beyond cervical cancer, like the anal, penile, vulvar, vaginal cancers as well. But the key distinction is that we have organized screening programs in Canada for cervical cancer. We do not have that for the other cancers. So it really depends upon, people presenting with symptoms and encouraging patients. If you do notice something's off in any of those areas, it's important to get checked out.
Mm-hmm. The other thing that HPV can cause is genital warts or warts in other parts of the body as well. And so certain low-risk strains of HPV can cause genital warts. They're common. They're not cancerous. And while they can be both uncomfortable or emotionally distressing, they are treatable. It's important to separate the strains when we think about the strains that cause warts from the high-risk strains that are associated with cancer. They actually are different types of HPV. So if someone has warts, it does not mean they will get cancer, but it does flag that screening and vaccination is really important.
They have this really interesting study out of Quebec actually looking at patients who were diagnosed with warts from HPV-related warts versus HPV-related cancer. And they actually found the emotional distress of warts was higher than the emotional distress of being diagnosed with cancer because it has such a significant impact visually because you're seeing it.
Right.
And I know a lot of my patients, I used to do much more sexual health and worked within clinics. And that was mainly what we were doing. We were treating warts being reassuring. People were coming in frequently. So we really saw their progression over time. And the impact of warts, we kind of say, oh, it's a wart, but it has a huge emotional component to it because this is what people can see. It doesn't mean that you're dirty. It doesn't mean that something is wrong. It means that you've been sexually active, like many of us have. And so it's such a common thing, and some people will develop warts, some won't. But it was really fascinating to see that distinction between like the emotional level of distress that can happen between a diagnosis of warts. So it's not a minor issue for many. It's something that we do take seriously as well because it has impact.
Yeah, absolutely. So let's move into vaccination, and that's where prevention really becomes proactive. In Canada, we use Gardasil 9, and it protects against the high-risk HPV strains that we've talked about that are responsible for most of those HPV-related cancers. Thankfully, it is publicly funded through school-based programs across provinces, and it's recommended for both boys and girls and actually approved up to the age of 45. Now, it works best before exposure, which is why it's given in early adolescence, but some adults may still benefit from it depending on age and risk.
Yeah, I have a nuanced conversation with patients. It's also covered by private drug plans. Ideally, it would be covered across the board of all ages because it is an expensive vaccination. But what I suggest is like have that discussion. You can go beyond the 45 as well for some folks. It's just that we assume that you've been exposed probably to HPV if you've been sexually active. So probably your body has some natural immunity, but having the vaccination can boost that further. The impressive thing about the HPV vaccine, it is a cancer preventing vaccine. And we have real world proof that it works. In Australia in particular, we know that they're the first to adopt this widespread school-based vaccination program. And they are on track to eliminate cervical cancer as a public health problem in the next decade, like in the next few years even. And that is based on like they're tracking it, and it's extraordinary. We know that we can do this here as well. But we also, and what we know in Canada, in our data, what we followed is that vaccinated populations have lower rates of high-grade changes on the cervix if they are infected. So it really does decrease the risk of progression to cancer, and it is one of the most effective cancer-preventing tools that we have.
And I mean, it's really great to hear that, like, example of Australia, where they are clearly on track to eliminate cervical cancer because of the high vaccine uptake rate there. And this is the part that concerns me here because Canada's vaccination rates have dropped during the pandemic and have not fully rebounded in many provinces. And in some regions, uptake is sitting well below kind of the place that we need to be to have strong community protection. And so like sometimes as low as 60 or even lower %. And so that part is definitely concerning when we hear this like great example of Australia that has a high vaccine uptake and are on track to eliminate cervical cancer. Whereas in Canada, we're actually starting to see a drop in those vaccination rates.
Yeah, similar to measles, we need to have a certain percentage of the population vaccinated to actually protect against diseases. And so the lower uptake does mean that we're going to see rates go up. And this is likely why we're seeing the rates go up over time in Canada right now of cervical cancer in particular.
So let's talk a bit about screening. And there have been some changes for cervical cancer screening in Canada. And it is, I mean, like this is stuff where science is always evolving. And so screening in Canada is evolving as well. And so we're transitioning from that traditional PAP cytology, like where you get your PAP test and you look at cells under a microscope to look for those like precancerous cells like we talked about, to primary HPV testing. And so HPV testing is a lot more sensitive, which means that it has a higher ability to rule out things, and it detects those high-risk HPV viruses before those cell changes even develop. And because of that, screening intervals are actually lengthening in many provinces. So like, previously with PAP tests, you were getting a PAP test every 1 to 3 years, kind of depending on your background and risk factors. And now with this more sensitive HPV viral testing, we can actually stretch that to once every 5 years.
And that's an important point, Chaz, because I think a lot of patients ask me, they're like, well, that puts me at higher risk, doesn't it? Because I'm not being seen as often to be screened. But we know that because the HPV test is a better test at picking up the actual presence of virus. And as we mentioned earlier, there's a lag time between infection to actual development of changes in your cells. that time frame is okay because we know that most people will, again, clear the virus within that 1 to 2 years. If we over-test, we end up doing a number of interventions on the cervix. That's traumatizing to the cervix, but to our patients as well. It's not a comfortable test to go further down that line. And we can prevent that from happening by doing screening at appropriate intervals.
Mm-hmm.
Doing a Pap test is not an easy test for many people. I think we see this as a benign test. It's something that we routinely do. But I have a lot of patients, I'm sure you've seen this as well, Shaz, that having any sort of invasive procedure where we're inserting something into your body, like a speculum, when it comes to doing a Pap test or HPV test collection, it can be uncomfortable.
Mm-hmm.
So what's happening specifically in BC right now is that they're offering self-collection methods. This is really wonderful for patients who may not be able to do the routine speculum insertion testing. For my gender diverse patients, this is a really important test as well. If anybody has a cervix, this is why we do these tests. That's if you don't have a cervix, you do not need to have the HPV testing for cervical cancer. But the self-swabbing method will be a game changer as well. And we're hoping to implement that in Ontario in the coming years as well, just to make it a low barrier method to actually screen. Even if you're vaccinated, so if you do get the vaccine, it's still important to screen because the vaccine does reduce the risk, but does not take the risk completely. And the last comment is that every province is different across the country. I wish we were a little bit more uniform with this, but some provinces have not yet implemented HPV testing. Some are doing the Pap testing. So check your own provincial guidelines for cervical cancer screening to see what is applicable to you in your own province or territory. So back to our listener question, what happens if you do get a test result of HPV being positive? So you have a HPV positive test result. So let's walk through this really clearly. If your HPV test is negative, you return to the usual interval of screening. So you do that every 5 years. If you have a positive HPV test, from the same sample that the HPV test has been done, so you don't have to have a second test, we actually then test the cells. So it's like the Pap test is done, basically looking at the cells, like you said, Shaz, looking for precancerous changes. And so we look directly. So positive HPV test, then they automatically have a reflex at the lab that they're going to do that next step of looking at the cells directly. If the cells show high-grade changes, then you'll be referred to something called colposcopy, which is with our gynecology colleagues, and they will be looking at the cervix under a microscope, so in a way that I can't see in my office, and they're going to take a closer look at the cervix using magnification, and on occasion, they'll do a biopsy. I would say that's actually decreasing quite a bit since when I started practicing 20 years ago. It's remarkable how much this process has changed. The key thing to remember is that even with a referral to colposcopy, it does not automatically mean that you have cancer at all. It means that we're taking steps to make sure that we're monitoring things closely to make sure it doesn't progress to that. So if your HPV, the other side of this is that if your HPV test is normal and the cells are also normal, we usually just repeat this HPV test in about 1 to 2 years to see if your immune system has just cleared the virus. So, because again, most people do clear it. And so that's the
And sorry,
processes.
Sheila, if your HPV test is positive, but your cytology is normal, right?
Exactly.
Yeah.
So there's a HPV positive with abnormal cells. Then we go to colposcopy, which is a specialist referral. If you're HPV positive, but your cells are normal, we just repeat the HPV test earlier than the normal 5-year interval.
Okay. And that's because, like you said, most people actually do clear the virus. Okay. Now, there's a bit of a asterisk for people who are immunocompromised. So, for example, people living with HIV or on immunosuppressive medications, or if you've had a transplant and then you're on immunosuppressive medications as well, we do actually screen more frequently. And if someone does have a history of high-grade dysplasia, so those precancerous cells, then we also follow those people more closely. And so that's something where it's important to talk to your doctor and nurse practitioner, because your screening is going to be a bit more individualized based on what your other risk factors are.
Absolutely.
Okay, so I always love wrapping up the show in this way with this rapid myth clarification. And so before we close, let's clear up a few common myths that we hear in practice, on social media, in the media about HPV. So Sheila, do you want to go first?
Yes, absolutely. There's so much, again, misinformation. We're going to be talking about misinformation in an episode coming up. So this is an important one to hit. So Shaz, here's one that I hear a lot. We sort of touched upon it earlier. So HPV means that someone cheated. And absolutely not. That is not what that means. It means that you were exposed at some point. It means that you've been sexually active. And that does not mean that someone cheated. It likely just means that it's been lying dormant for some time. And it was present when we tested for it. But it doesn't mean that somebody is actively there's active infidelity in the relationship. It just means that you have a positive test and that you've been sexually active in the past.
Mm-hmm. Another common one I hear a lot is that an HPV positive test means I have cancer. So the answer to this, like we talked about, is no. It means you have the virus. Depending on the strain of HPV, it could mean that you have a high risk strain that could put you at higher risk of cancer, but the virus does not mean cancer, like we talked about. Even if you have a high grade or a high risk HPV virus, it will take time for that cancer to develop, which is why screening is so important.
So a big one that people will often mention to me, Shaz, is like, I feel fine. I don't need screening. And this one is false because we pick up these changes. Screening means that we're picking up changes before issues become symptomatic. Mm-hmm. And that's a really key distinction. If you are having symptoms like abnormal vaginal bleeding or pain or pelvic pain sort of idea, that means that we aren't screening anymore. We're looking to diagnose the issue.
Right.
So screening means that we are trying to pick something up before it becomes an issue so we can deal with it before something sets in. And so, yes, if you have been sexually active in your life, and this is a really important point, actually, if you've never been sexually active, so no fingers, toys, any interaction at all with other individuals, you actually don't need to have screening done for cervical cancer because it's really HPV is dependent, like the transmission is dependent upon that sexual contact. So I always check with my patients and I regularly check in with them if they become sexually active because it means that we start testing them. But if you feel fine, you still do need to have screening done just like any other screening test that we do.
Right. And we actually do have an episode from season 1 of the podcast on multiple different types of cancer screening. So be sure to check that one out as well. Okay. Another one that I hear is that the HPV vaccine is only for girls. This is another false one for a few different reasons. So HPV is transmitted by close intimate contact. And so that can be from boys to girls, boys to boys, girls to girls, right? And so having a vaccine for everybody is going to be important, but also it is not just leading to cancers that are specific to females. It can also lead to the other cancers that we talked about that do not discriminate based on sex.
And we're all going to be like potentially sexually active with each other, right? So we all have a responsibility to protect each other in that way. It's not just girls protecting themselves or their partners. We protect each other collectively, and it's not just a girl vaccine.
Exactly.
The last one is that I'm too old for the vaccine. And this is not true. Like I mentioned earlier, we have a nuanced conversation. The vaccine is approved up to age 45, but we can give it for folks after that. We also give the vaccine to individuals who do have an abnormal, like a positive HPV test as well, just to see if we can boost the immune system a little bit to help them clear the virus faster as well. So we have that conversation with our patients. It's a nuanced discussion, and there is no actual end date to doing the vaccine, but currently the cutoff date is 45, but that's not an actual absolute. So to close, we just want to emphasize and just give you some reassurance here. HPV is so common and most infections do clear on their own. Your immune system is amazing and it will do the trick for you. Cancer is not inevitable. Prevention only works, though, if we participate in it in terms of screening. So if you're overdue for your screening test, please do take a moment today and book that test.
And if your child is eligible for the HPV vaccine, please don't skip it. We have a vaccine against cancer, and it's incredible. If you have received an abnormal result, it's understandably stressful, but remember that most HPV infections do not become cancer. So it's important to follow up, stay engaged, and not to panic.
Thank you to everyone for tuning in to the Doc Talk. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your healthcare provider for questions related to your personal health needs.
And make sure to follow us on social media at the Doc Talk Pod. And be sure to like, subscribe, and review us wherever you get your podcasts.